Hello everyone, Dr. Morse, Injury Experts. So if you haven't been here before, I am a sports medicine physician in Miami, and we're going to talk about Rashee Rice, the stud wide receiver for the Kansas City Chiefs, who unfortunately suffered a knee injury about a week ago, and we've been waiting on pins and needles to see exactly what's going on because of how rare this is. Usually they tell us very quickly, but they said, no, we're going to wait, we're going to check it out. He has a lot of swelling. And then today, Dr. Dan Cooper, who's one of the aftermost specialists in the knee in the country, who also happens to be the team doc for the Dallas Cowboys, went inside of his knee to check it out. Now, before we go any further, I want you to watch the play of how it happened, because this is very important. And this is going to tell us why this is such a rare injury. Now, when we watch the play here, you can see Mahomes, of all people, hit Rice's knee from an anterior and medial approach, meaning front and inside. Now, this is the outside of the knee, so he came across and hit this side of the knee. So why is that such a big deal? Almost everyone gets hit on the outside of the knee. Why? Because that's where it's most vulnerable. The inside of the knee has the other knee here. That's why it is rarely injured on the medial aspect from a direct force standpoint. You can hit it directly in the front, or you can hit it directly from an angle like this, or directly on the side. But coming directly across or angled this way is actually super rare. So what happened to Rice? Now, we knew he didn't have a full thickness tear of his ACL, because they would have told us it would have been blatantly obvious on MRI. But regardless of how many MRIs they did, they were not confident in exactly what happened to his knee. So now that tells us this is way more complicated than just imaging can show us. Now, there is a possibility there is still damage to the ACL or the PCL, but there is one ligament that was actually injured that is super rare. And what is it? The LCL. Why? Because, again, you rarely get hit on the inside of the knee. So this ligament is almost always spared. This is a very, very rare injury. Only 2% of all knee injuries have an LCL injury in isolation. 40% of these are contact. So, again, when you think of someone tearing an ACL, that usually just happens without anyone hitting them, non-contact. When you see an LCL, it almost is half the time going to be contact in a weird, fluky manner. And that's exactly what happened here. Fluky play. Mahomes was trying to tackle the guy who just intercepted him, and unfortunately, he leveled Rice's knee, and as a result, he tore his LCL. But there's some more important things besides the LCL over in this corner. This is what we call the posterolateral corner, or the PLC. This is very important for lateral stability and very important to the knee itself. Now, Rice underwent a scope today by Dr. Cooper, and they evaluated that, yes, the LCL needs to be either reconstructed or repaired. There is another level to this that the tweets here from both Schefter and from Rappaport kind of are a little misleading. Why is it so misleading? Rarely are they on different pages. But you can see one saying, no, he's fine, this is pretty much an isolated LCL. And the other one saying, hey, he might actually have more damage, and they're not going to know until he goes in. Well, they went in today, from what it sounds like, and that is what they initially found. So did they find a partial tear of the ACL? Did they find a partial tear of the PCL? Did they find additional damage to the lateral aspect of the LCL and of the knee, which would be the posterolateral corner? Now, about 35 to 44% of the time, depending on which study you look at, there is an additional injury that has a complication. There is a very important nerve called the peroneal nerve that runs around this section of the fibula right here. That is what causes foot drop. If you've ever heard of the foot not being able to pick up, that can happen with this because the LCL actually attaches right here. And if you injure that, you can actually injure the nerve. Now, and sometimes this can even be a result of the surgery. It's less common, but it can technically happen. Now, it will be interesting to see what surgery they actually choose to do on him. I'm assuming Dr. Cooper is going to do the surgery. And what we've seen is that there are complications with repairs, meaning using the current tissue. And they prefer to reconstruct using other tissues from other areas of the body or from a donor to reconstruct this ligament because it has less complication rate. The other one has about, a repair has about a 40%, up to a 40% fail rate, which is very high, whereas reconstruction is only up to about 6%. So significant difference there. Now, the other thing that will be interesting is that if this is an isolated LCL injury, super rare, again, 2%, he's still done for the year, but he's good for 2025. Not talking about suspension and all the other stuff, just from the medical perspective. But if he also has a PLC, posterolateral corner, which would not surprise me, or he also has an ACL that needs to be repaired, because at this point you repair it, then that's going to compromise at least possibly the beginning of his 2025. If he has a PCL, that's not as concerning. That's the posterior cruciate ligament. That's the same thing that Puka's dealing with. Now, with that being said, it will be interesting to see over the next 24 hours how this plays out. Unfortunate injury. It's safe to drop him. Hold him in Dynasty. We'll see after probably tomorrow, the next day when they release more information about exactly how to reevaluate him. But there's another important piece here. How long does this take to recover? This takes 6 weeks in a knee brace before you can start doing anything. So he's done for the season. Then you cannot strengthen hamstrings for 4 months after this surgery. Think about that statement. 4 months. That means he's going to have significant atrophy and size decrease. You're not going to just do one leg because now you have a significant abnormality and a misbalance, kind of like Christian Watson. So he can't do hamstrings because one of the major hamstrings actually attaches laterally over here, which is where the PLC and the LCL attach. So it's too risky to re-injure that reconstruction. So he's going to then have to spend a lot of time building up those hamstrings again after he's cleared to do that. So he's got a little bit of a journey ahead of him. Again, you can add a further wrinkle by saying he also tore his ACL. We don't know that yet. And that would delay him even further because of the situation. The only reference that comes to mind for guys that suffered a similar injury are J.K. Dobbins and Gus Edwards. They were both in the same backfield. I know it's weird. J.K. Dobbins had the ACL and the LCL, or what we call PLC, posterolateral corner tear. Remember, J.K. Dobbins was a contact ACL tear, only 25%, quite rare. Gus Edwards was not, I don't remember the contact, but I don't know how much of his LCL was affected. But J.K. Dobbins is a decent comp if the ACL is torn. If it's not torn, then it's isolated. And I still have concerns about this knee in the long run because this is such an important part. There's popliteus ligaments, there's muscles, there's a lot of things over there that are very important that sometimes just don't reconstruct well. And sometimes that knee is never the same. I'm not one to sugarcoat things. Unfortunately, that's the harsh reality. Let's hope everything's fine, and let's hope it reconstructs and everything's great, and he comes back and he smashes just like he did before this year. But there's a possibility he just doesn't have the same range of motion or explosiveness on that angle. If you like this type of content, do me a favor, smash a thumbs up, subscribe. Again, I'm Dr. Jesse Morse, a board-certified sports medicine physician in Miami. If you have any questions or comments, I'd love to hear them below. This will be both on our YouTube channel for the Injury Experts as well as on my Twitter. Thank you for tuning in. We will give you more updates as they come in. Take care.